Have you ever heard a doctor say, blood pressure of 120/80 is fine, and you breathed a sigh of relief? But did you know? There is another number that very few people pay attention to. It can reveal the biological age of your blood vessels and predict the risk of future heart attack and stroke. That number is called pulse pressure. Today, Smart Wellness Tips will help you clearly understand what pulse pressure is, why it is more important than you think, and 5 simple steps to improve pulse pressure naturally. For many years, when it comes to blood pressure, most of us have only been interested in 2 familiar numbers, the top blood pressure and the bottom blood pressure. Many people only need to hear the doctor say 120/80 is good to be completely reassured. But in reality, there's a very important indicator that is often ignored. While it can reveal the biological age of the vascular system and future cardiovascular risk, that indicator is named pulse pressure. 1. What is pulse pressure? Pulse pressure is the distance between systolic blood pressure, top number, and diastolic blood pressure, bottom number. The formula is very simple. Pulse pressure equals systolic blood pressure minus diastolic blood pressure. Example: if your blood pressure is 120/80, then the pulse pressure will be 40 plus mmHg. If the blood pressure is 140/70, the pulse pressure will be 70 mmHg. Just by looking at the example above, you can see 2 people both have a top blood pressure that is not too high, but their blood vessel conditions are completely different. 2. Why is pulse pressure so important? Pulse pressure directly reflects the elasticity of the arteries, which is the ability of blood vessels to expand and contract when the heart pumps blood throughout the body. You can imagine it like this. Young, healthy arteries are like a good rubber band. When the heart contracts, blood vessels expand gently, absorbing the pushing force of the blood flow. Old, stiff arteries are like hard plastic pipes. Blood is pushed away with great pressure, creating a high difference between the 2 blood pressure indicators. Based on pulse pressure, it is divided into 3 zones. Flexibility zone. Normal. About 40 mmHg. This is the ideal level. Arteries are still soft, with good elasticity. Low cardiovascular risk. Stiffness zone. Warning: 50 to 60 mmHg. Arteries begin to gradually lose flexibility. The risk of high blood pressure, heart disease, and kidney failure begins to increase. Danger zone. Above 60 mmHg. This is a worrying sign. Research shows that when pulse pressure is over 60, the risk of heart attack and stroke can double. Arteries likely have been severely stiffened or calcified. 3. Causes of high pulse pressure. Pulse pressure does not increase randomly. It is the result of many factors accumulating over time. Natural aging. As we age, arterial tissue gradually transitions from soft and elastic to hard and less flexible, like old rubber that has become calloused. Atherosclerosis, cholesterol plaques, inflammation, and calcium buildup in the vessel walls make blood vessels thicken and harden. Imbalanced diet, eating too much salt, and causes blood vessels to retain water, increasing pressure. Eating too little potassium reduces the natural ability of vessels to dilate. Prolonged stress and lack of sleep. Stress increases the hormone cortisol, causing blood vessels to constrict continuously, leading to stiffness over time. Mistakes in blood pressure treatment. Some people use blood pressure medication that makes diastolic blood pressure drop too low, below 70, while the top pressure remains high. The distance between the 2 numbers is widened, causing pulse pressure to increase. 4. How to improve pulse pressure naturally. 5-step plan. The good news is, pulse pressure can be improved if you change correctly and persist. Step 1. Balance sodium and potassium. Reduce salt intake to below 2 grams per day. Increase foods rich in potassium such as beans, avocados, sweet potatoes, bananas, green leafy vegetables. Potassium helps blood vessels dilate, reducing pressure on the vessel walls. Step 2. Supplement necessary nutrients. Magnesium glycinate helps relax blood vessels, improving elasticity. Omega-3 reduces inflammation, limits arterial stiffness. Note: should consult a doctor if taking medication. Step 3. Smart exercise. Walk 30 minutes every day. Combine isometric exercises, static holds 2 to 3 times per week. Example: plank, wall sits, gentle muscle squeezing. These exercises help improve vascular function without overloading the heart. Step 4. Stress control. Practice slow, even breathing resonance breathing before sleep. Inhale slowly for 4 to 5 seconds. Exhale slowly for 6 to 7 seconds. Just 5 to 10 minutes every night also helps reduce pressure on the nervous system and blood vessels. Step 5. Sleep enough and properly. Sleep 7 to 8 hours per night. Bedroom should be cool, dark, and quiet. Avoid phones and stressful news before sleep. 5. Important note. If you have applied the above steps for several months and pulse pressure is still over 60 mmHg, do not be subjective. Have a discussion with your doctor to check for further issues, such as heart valve disease, anemia, thyroid disorders. Conclusion. Pulse pressure is not just a secondary number. It is a mirror reflecting the true age of your vascular system and your cardiovascular health. Taking care of pulse pressure is an investment in a healthy heart and a safer future. If you found this video helpful, please hit like. Subscribe to the Smart Wellness Tips channel. Comment. Have you ever heard of pulse pressure before? See you in the next video.